As we continue talking about Black History Month here this February, Luke, we want to highlight one of the most prominent African-American doctors that has some local ties to Rockford.
You bet. It's a very fascinating story. His name is Daniel Hale Williams, and he was born in 1858, not in Rockford, but when he was pretty young, he moved here, lived here for about 5 years before his family moved back to Baltimore. Shortly afterward, his father died of tuberculosis. Jeez.
And come out sometimes.
Yeah,
we'll be the first to tell you.
Tuberculosis.
We know that. Yeah. There you go.
And then his mother apprenticed him to a shoemaker in Baltimore, and she moved back here to Rockford with family. Well, he wasn't happy with that, and shortly afterwards, about a year later, moved back to Rockford, where he became an apprentice barber, and he had barbering through high school in Edgerton and Janesville and Rockford. But then he wanted to become a physician. And as an African American, in that time, it was very difficult to be accepted to medical schools. However, he did find a sponsor in Chicago and enrolled in medical school. 3 years later, he graduated as a physician, but his goal was to be a surgeon. The challenge there was that you couldn't be a surgeon without admitting privileges at a local hospital, which were denied to black physicians at the time. Okay. So he opened his own hospital in Chicago at 27th and Dearborn, called Provident Hospital, and nursing school. One of the reasons he also wanted to open this hospital was because black nurses were not also allowed to train and become professionals, even though for decades and decades, black women going back to the slave era were known as caregivers. And so he pioneered this medical school for nurses and doctors in Chicago.
And talk about just the way he's kind of paved the way for so many too.
Well, yes, he became very well known because in 1893, the summer of 1893, he performed the first open heart surgery.
Incredible.
Oh my
goodness. And it was, at the time, the medical field felt that it was very irresponsible and dangerous to operate on a beating heart. They didn't have anesthesia, had the heart-lung machine, transfusions. They didn't have what we now have to safely perform that, or so they thought. But that summer, a patient showed up with a stab wound between his fourth and fifth rib. After fixing the stab wound, he noticed that the patient was still having internal bleeding, suffering from shock, and he concluded that obviously some of the heart and surrounding blood vessels were damaged. So he opened him up and saved his life. He repaired the arteries. He stitched together the pericardium, the lining of the heart, and within about a month or so, the patient left the hospital healthy.
That's incredible.
And people don't realize that the ties to Rockford too. I mean, you would never guess that.
Yeah, and you and I were just talking about it, and obviously his long-lasting legacy as performing that first open heart surgery, but also training the nurses in proper medical procedure, and then having them actually come back to Rockford and serve at Camp Grant, which we've talked about many times.
You bet, exactly. So this first open heart surgery was in 1893. He's training nurses at the same time and graduating a lot of talented nurses. Quite a few were from Rockford. One was his cousin Mabel Williams, and she and some about 8 or 9 other local nurses that graduated from his nursing school came to Camp Grant, and he also had a group sent to Camp Sherman in Ohio, and this was in 1917, 1918. And at that time, black nurses were not allowed to treat white patients on military bases. That changed in 1918 when the influenza pandemic came through, and there were so many cases of sick soldiers, and these African-American nurses gained the opportunity to treat soldiers of all colors, and especially at Camp Grant. About 8 or 9 of them were there, including Mabel Williams, who was in his first class at Provident Hospital in Chicago.
Incredible stuff. Well, Luke, we really appreciate you always coming on every Thursday. Look forward to next week and the interesting topic that you bring then.
Thanks for having me.